Hi, everyone, and welcome to DAS Health webinar, Optimizing Patient Care with CCM and RPM Services, the Future of Healthcare Management. My name is Lindsay Lanning, and I am on our product management team for DAS Health. Now, before I get started, I would like to take a moment to explain the process for today's presentation. First, I want to mention this webinar will be recorded. Don't worry if you have to jump off early. We will send out a copy of the slides and recording within the next week. Next, for those of you who aren't familiar with DAS Health, I encourage you to please visit our website to learn more about us. Connect with us on LinkedIn. We always post news, links to our future webinars, etc. A lot of great updates on our LinkedIn page. And then, of course, subscribe to our YouTube channel, where you can access all of our historical webinars. I also want to mention some upcoming webinars that DAS is putting on over the next few months. We don't have any patient engagement webinars scheduled right now, as we're actually looking for your feedback on what you want to learn more about. We're considering how maybe RPM and CCM can help you meet PCMH or other value-based care arrangements, maybe even a deep dive into strategic campaign initiatives to get your patients enrolled in these programs at your practice that have really shown success at other practices that we work with. We are totally open to suggestions from you. Feel free to post those in the chat or the questions if you have any ideas for us. Now, if you do register for any of our upcoming webinars, we will be sending out an invitation to each webinar a week or so before. And again, we always post on our LinkedIn page as a reminder, so keep your eyes peeled for that. Okay, so back to today's webinar on optimizing patient care with virtual services, CCM and RPM. So at the end of the presentation, we're going to open up the floor to questions from you. We will answer all of the questions at the end, but you may type them in the questions area on your webinar control panel whenever they occur to you. And then finally, for audio clarity purposes, you might notice everyone's phone will remain muted throughout the entire webinar. If you do happen to experience any audio issues, please use the chat box to let us know so we can help you resolve them. And again, questions can be entered in the questions box at any time. So without further delay, I would like to introduce our presenter for today, Brandy Bond, one of our product managers here at DAS and an expert in everything RPM and CCM. What many people don't know is Brandy is a nurse of 28 years and has 19 years experience in a large family practice group setting. So she thoroughly understands the challenges your practices are facing when it comes to patients and payers. So Brandy, the webinar is all yours. Really feel free to get started whenever you're ready.
Thanks so much, Lindsay. Thank you everyone for joining our webinar today on optimizing patient care with virtual services, CCM and RPM. In this webinar today, I will discuss chronic care management and remote patient monitoring and the vital role these can play in your practice. Many practices across the country are looking for ways to increase practice revenue and enhance patient care. My goal today is to show you by partnering with DAS, a trusted healthcare solutions provider, and using the proper reimbursement, healthcare practices like yours can maximize care, decrease patient health costs, all the while increasing your practice revenue. For today's agenda, I will discuss what virtual services are and provide an overview of the two virtual services DAS has to offer: chronic care management, CCM, and remote patient monitoring, RPM, and how these two solutions can add value and increase revenue for your practice. I'll be answering key questions: which patients are eligible for chronic care management and remote patient monitoring? What are the requirements for chronic care management and remote patient monitoring? And how you can implement chronic care management and remote patient monitoring into your practice today. What are virtual services? Well, in short, virtual services like chronic care management and remote patient monitoring are delivered to patients in the comfort of their home via phone or secure device. Fully reimbursable under Medicare, they provide a great way for providers to expand and improve their services for their most vulnerable patients. These services are care coordination that happens outside of the regular office visit to assist patients who have both acute and chronic conditions. CMS is moving toward value-based care through virtual care services, CCM and RPM, which have paved the way for providers to hold patients accountable for the participation of their care, decrease the volume of patient visits to ERs and hospitals, and cut healthcare expenses for both patients and practices. Let's discuss chronic care management first and how the program can improve patient care and increase revenue for your practice. What is chronic care management? Chronic care management are services that are offered additional help managing chronic conditions. This includes a comprehensive care plan that will list the patient's health problems and goals, other providers, medications, community services the patient may have or need, and other information about the patient's health. CMS recognizes that chronic care management is a critical primary care service that contributes to better patient health and care. CMS defines chronic care management as care coordination services done outside the regular office visit for patients with 2 or more chronic conditions expected to last at least 12 months or until the death of the patient, and that place the patient at significant risk of death, acute exacerbation, decompensation, or functional decline. These services are typically not face-to-face and allow eligible practitioners to bill for at least 20 minutes or more of care coordination services a month. An estimated 117 million adults have 1 or more chronic health conditions, and 1 in 4 adults have 2 or more chronic health conditions. As you can see by the statistics, that this is why CMS recognizes chronic care management as a critical service. But chronic care management continues to be underutilized in practices across the country. Did you know that 1/3 of Medicare beneficiaries have 4 or more chronic conditions? 7 of the top 10 causes of death in 2019 were from chronic diseases, and people with chronic conditions account for 86% of the national healthcare spending. People with chronic conditions receive only 56% of the recommended preventative care services, and 99% of Medicare spending is with patients with chronic conditions. The statistics are staggering, and practitioners are struggling to maintain these patients. Patients are also overwhelmed with doctor appointments, medication management, and just how to cope with chronic conditions that affect their lives daily. This leads us into why chronic care management is so important for your patients and your practice. Unfortunately, most healthcare providers don't have the capacity or infrastructure to manage the hundreds of Medicare patients in their practice with multiple chronic conditions on a monthly basis. This is why chronic care management is so important for your practice. Your patients will gain a team of dedicated care coordinators who can help them plan for better health and stay on track with their care. Patients will receive a comprehensive care plan. The plan will help support disease control and health management goals, including physical, mental, cognitive, psychosocial, functional, and environmental factors. Improved care coordination. Chronic care management can help improve care coordination and health outcomes by following up with patients after ER and hospitalizations and ensuring those discharge summaries are available and medications are reconciled monthly in the patient's health record. Medication reconciliation is a time-consuming process during an office visit for your staff, especially if patients don't remember to bring their medications to the visit or even remember what medications they're currently taking. CCM assists in alleviating this burden on your staff at a regular office visit. Also offers support patient compliance and help patients feel more connected. When patients feel more connected to your practice, this leads to patient loyalty and trust. Sustain and grow your practice. Ongoing care management outside the in-person visit has not always been separately billable. With CCM, you can provide you with additional resources to help your practice care for high-risk, high-needs patients. Your staff is already reaching out to these patients, but you are not being reimbursed for these calls. Practices that do not offer CCM services are missing out on the opportunity to provide the connected care their Medicare patients need and want. Encouraging patients to use CCM will give them the support they need between visits while lessening the burden on your staff, especially with staff shortages being at an all-time high. Chronic care management has been proven to help manage patients' health more effectively, improve communication among treating clinicians, and provide a way to optimize revenue for your practice. As you can see, CCM has even more benefits. faster time to critical intervention, improve population health and outcomes, reimbursement opportunities, combat clinician burnout, expanded access for your patients, and to improve patient engagement and relationships. You may be skeptical about virtual services combating provider and staff burnout, but by partnering with DAS, you are not responsible for the patient follow-up and outreach, as we have dedicated care coordinators who will facilitate this for you. Our care coordinators assist with answering patient questions that would have originally gone to your practice as a phone call or a portal message. From personal experience, we all have patients that require more time than we have to give. As a nurse in a busy practice, I was able to take advantage of chronic care management to alleviate the burden of multiple phone calls a week to high needs patients. This freed up valuable time in my day and allowed me to have a better work-life balance, and those patients were able to receive the extra care that they needed. Okay, let's talk about eligibility and requirements for CCM. CMS has outlined specific requirements for who is eligible for chronic care management services. The patient must be 65 years or older with either Medicare or Medicare Advantage insurance. They have to have had a face-to-face encounter in the last 12 months, and patients must have 2 or more chronic conditions that are expected to last at least 12 months or until death, and that place the patient at significant risk of death, acute exacerbation, decompensation, or functional decline. And patients must give either verbal or written consent to be a part of the program. And that must be recorded in the patient's health record. Here are a few examples that we provided for eligible chronic conditions. This list is not all inclusive, but as you can see with a few examples given, how many of your patients will qualify for CCM services. Now that we know what patients qualify for CCM, what clinicians can provide CCM services. So CMS identifies both locations and provider types. Locations include a physician office, federally qualified health centers, rural health clinics, and critical access hospitals. Whereas the provider types include physicians, certified nurse midwives, clinical nurse specialists, nurse practitioners, and physician's assistants. An important note, all providers must be licensed in the state that the patient receives care, and CCM services cannot be provided by any limited licensed physicians and practitioners, such as clinical psychologist, podiatrist, or dentist. These practitioners may consult and refer such physicians and practitioners to coordinate and manage care, but they're not allowed to provide CCM services. CMS requires these services be met for CCM: assessing the patient's health, mental, and psychosocial needs, ensuring all patients receive the recommended preventative services systematically, assistance with medication management, managing a patient's transition of care between providers and healthcare settings, providing a comprehensive care plan, and 24 access for urgent care needs. Medication management is an important aspect of CCM. Many patients are overwhelmed with the number of medications they take and the cost of those medications. From personal experience with patient care, some patients must decide if they're going to be able to pay for medication that month or pay for food. This is where care coordinators are vital in assisting patients with their medications and working with your staff to not only ensure patients are taking their medications as prescribed, but can afford the medications they should be taking. Our goal is to improve the patient's quality of life by assisting with their needs. Now that we've established who's eligible for CCM services, let's dive into billing for CCM. Billing restrictions that CMS outlines are: only one practitioner may be paid for CCM services for a given calendar month. So it might be necessary to coordinate with the subspecialist who might be providing a significant amount of care and treatment to one or more of the patient conditions. It is important that patients understand that only one of their multiple physicians will be able to bill for CCM services monthly. Our care coordinators address this when enrolling patients into CCM and or RPM services, which I'll cover again in upcoming slides. The practitioner must only report either a complex or non-complex CCM for a given patient for the month, not both. So a regular or non-complex care, patients receive at least 20 minutes a month of dedicated time by a care coordinator, and complex is more than 60 minutes of services a month. And program overlap. The CCM service codes provide payment of care coordination and care management for a patient with multiple chronic conditions within the Medicare fee-for-service program. Medicare will not make duplicate payments for the same or similar services for patients with chronic conditions already paid for under the various CMS Advanced Primary Care Demonstration or other initiatives such as CPC Plus. And skilled nursing facilities cannot bill services provided to skilled nursing facility patients or hospital patients in Medicare Part A. There are multiple billing codes for chronic care management, but for today's presentation, we're only going to discuss 2 billing codes. You can find all of the CCM billing codes and their detailed explanations of each code on the CMS website. So let's start with the first one. 99490 is chronic care management services, at least 20 minutes of clinical staff time directed by a physician or other qualified healthcare professional. This is the most common billing code and can be used monthly. As required by this code, a comprehensive care plan for managing conditions is developed, established, monitored, revised, and implemented every month. And the approximate CMS reimbursement for this code is $62. The G code, G0506, is the comprehensive assessment and care planning. The patient is enrolled in person by the practice, and a systematic assessment and care planning personally performed by the billing provider must be done. This is a one-time billable code per enrolled patient, and the approximate CMS reimbursement for this code is $60. Okay, so now that we've gone over all the ins and outs of CCM, are you ready to implement the services into your practice? Our turnkey CCM program offers a dedicated care team that contacts patients monthly at a convenient time for the patient in the comfort of their own home using an area code associated with your practice. Care coordinators are trained for intentional listening, responsiveness, and compassion. Comprehensive care plans are maintained for each patient, and the patient concerns are addressed via your EHR by the care coordinator to your designated staff. You do not need an expensive interface or a dashboard. We also offer bilingual care coordinators that are available for Spanish and Vietnamese speaking patients. We provide CMS audit assurance by meticulous time tracking, documentation, and reporting to ensure all services are fully compliant. We also mail a link to the patients that provides 24/7 access to their care plans, because not every patient is going to be signed up for your patient portal and have access to that care plan. How does our CCM program work? First, we comprise a list of all patients eligible for CCM within your EHR. We then send the list to you for review and approval. And once we receive the list, mailers are sent to the patients eligible for the program to soften the ground before our enrollment calls begin. Our care team contacts the patient and explains the program in detail and receives verbal consent that is added to the patient's health record. The patients are advised if they have Medicare only, they will be responsible for a 20% copay per month. And the patients can stop participation at any time in the program. If patients do have Medicare supplementary, then those usually pick up the copay amount. Patients will be contacted monthly by a care coordinator, and a comprehensive care plan will be maintained for each patient that is downloaded into their chart monthly. During implementation, we will set up with the care coordinators how to communicate patient needs via your EHR. To ensure, again, that we are compliant with CMS guidelines, we send that link in the mail to each patient that provides them 24/7 access to their care plans. We take CMS compliance seriously. There are several advantages to our CCM program. Increased monthly revenue for your practice. No additional software is needed. We work directly with your EHR. No additional burden on your clinic or staff, and we offer training and resources to maximize the coordination between the clinic and care coordinators. And also we have our accelerated enrollment program to drive patient participation. There are multiple patient benefits with our program. Regularly reviewed and updated personalized care plans. With a dedicated care coordinator, we strive to have the same care coordinator contact your patients monthly to establish a trusted relationship with each patient. Medication management. As discussed previously, this is an extremely important aspect for not only the patient, but provider and staff. And coordination with complete care team. So your primary care, family members, hospital, and specialists. Resources and encouragement to stay on track with your health goals. Care coordinators act as a cheerleader for your patients to encourage them to stay healthy. Early identification of potential health issues. Patients often forget to mention important details on an office visit that are revealed to care coordinators during the monthly calls. This can assist in early identification of health issues for each patient. Centralized health records from all your doctors, so the care coordinators assist with organizing discharge summaries from specialists, ER visits, and hospitalizations. We are there every step of the way, and our goal is to make a positive impact and to ensure the success and satisfaction for you and your patients while increasing revenue without adding additional costs. Now that you have a better understanding of chronic care management, let's talk about remote patient monitoring, which during the pandemic saw a 555% increase in usage among Medicare beneficiaries. It is estimated that 30 million patients will be using RPM by 2024. What is remote patient monitoring? RPM is the collection and analysis of patient physiologic data used to monitor and capture medical information from patients and electronically transmit this information to healthcare providers for assessment. What this all means is one very important thing. RPM allows healthcare providers to monitor patients outside the clinical setting. This is significant for chronic disease management and improving healthcare access for elderly, rural areas, and patients with mobility issues. The graph above shows RPM slashed hospital readmissions for heart failure and COPD. Hospitals and clinics across the country are reaping the benefits that RPM has to offer their clinicians and patients. Why RPM? I'd like to highlight some of the benefits of RPM can offer you. RPM allows the consistent monitoring of physiologic data. This can increase the speed of achieving treatment, thus saving time and money for both clinicians and patients. It also allows for real-time opportunities for intervention by treating readings outside of the patient's normal measurement limits. We all have those patients who suffer from white coat syndrome and whose blood pressure is extremely high in the office, but of course, when they get home, their readings are normal. Home-based blood pressure readings have been found to be more reliable and accurate than those taken in a clinical setting. This assisting clinicians to better treat patients with hypertension and other chronic conditions. This has the potential to decrease the number of ER and hospital visits a patient may experience. RPM also allows for the ability to view and access data trends over periods of time to make informed decisions for patients. This can be an engaging form of patient education by providing patients with a visual of how their vitals have trended over the last 60 days, which can be very enlightening and assist with tracking patterns that are causing an increase or decrease in the patient's vital readings. The increased number of touch points RPM offers allows for more opportunities to address other healthcare needs of the patient, but overall, increase the patient engagement and improve or deepen the patient relationship with the practice while all at the same time increasing the practice revenue. We've already discussed in the previous slide some of the reasons to implement RPM into your practice, but here are 4 more reasons if the previous slide did not convince you of the value of this program. Improve patient outcomes. Accurate data saves time, improves documentation accuracy, and leads to more effective management of the patient's health. Increase patient engagement. RPM allows patients to become active participants in their care by utilizing a physical device that is a constant reminder to work towards a healthy lifestyle. It can also boost practice capacity. RPM automates non-critical care-related tasks, which allow for organizations to focus resources where they are needed most. Also assists in lowering costs and increasing revenue. RPM should lower overall per beneficiary healthcare costs and increase revenue for your practice. RPM is becoming increasingly popular and is backed by growing clinical evidence and a host of non-clinical benefits. Now let's look at who qualifies for RPM and what the requirements are. For a patient to be eligible for RPM, they must have one acute or chronic condition that would benefit from physiologic monitoring, have Medicare or Medicare Advantage insurance, although some commercial insurances are now starting to reimburse for RPM, and not all participate. They need a face-to-face encounter in the last 12 months, and the patient, as with CCM, must consent to the program with either verbal or written consent that is documented in the patient's health record. RPM is available for patients with an acute or chronic condition, as we already discussed, and while RPM mainly focuses on chronic conditions, it can be used to treat acute conditions such as COVID. Clinicians can now monitor patients between office visits and receive a more comprehensive picture of their patient's health. So 2 common conditions that RPM helps you manage are hypertension. RPM is an excellent tool to help utilize with patients who have hypertension. Hypertension affects about 6% of US adults and has an estimated cost exceeding $50 billion annually, and is the most common chronic condition for which patients see their PCP every year. RPM can assist in better effectiveness of treatment and cue earlier changes in treatment to get blood pressure under better control faster. It can also assist in COPD. Not only enables potentially life-saving early detection of low blood oxygen levels in COPD patients, but it can also measure efficacy of treatment and prevents unnecessary exposure of COVID and flu and in-office visits for COPD patients. So let's review RPM main components. So the patient obviously must consent to the program. Patients must have both a monitoring device and a transmission device that sends data to an EHR. The devices must be defined as medical devices by the FDA and be ordered by a qualified medical professional. And the data captured by a device must be wirelessly connected. Patients must take and transmit readings of their vital signs for at least 16 days out of every 30-day period. And 20 minutes of clinical interaction is required per patient per month. CMS also stated that in their 2021 final rule, RPM services are limited to established patients. So this allows the physician to already possess information needed to understand the current needs of the patient prior to ordering RPM services. I would like to point out how RPM differs from CCM to avoid any confusion between the programs. So CCM is very similar to RPM. However, there are some key differences. CCM involves care coordination outside regular visits and differs from RPM in terms of patient eligibility and reporting requirements. With chronic care management, the patient must have 2 or more chronic conditions lasting at least 12 months or until death. And remember, you only need one acute or chronic condition to be eligible for RPM. For CCM, patients must be 65 years or older, and there's no age requirement for RPM. Patient monitoring times range from 20 to 60 minutes for CCM, and you must have 24/7 access for CCM patients to the care plan. I would like to encourage you to incorporate both chronic care management and remote patient monitoring into your practices. Although it is possible to enroll patients in both programs at once, CMS does not allow you to double count, which means if you bill for CPT codes 99457 for RPM and 99490 for CCM together, this requires a provider to deliver at least 40 minutes of services, so 20 minutes for CCM a month and 20 minutes for RPM monthly. This can be a hard sell to patients because they do not want to commit to 40 minutes on the phone of interaction every month with someone. The preferred approach is by either enrolling the patient in CCM or RPM. So if the patient is not a good fit for one program, they can be enrolled into the other program, which maximizes care opportunities for your patients and increase revenue for your practice. Okay, so RPM billing is a bit more complex than CCM billing. So let's take a look at how billing works for RPM. Medicare rules for RPM billing are challenging, but these rules should not be viewed as a barrier to provide important RPM services to patients. Practitioners should be familiar with and structure their service delivery models to meet Medicare's requirements. Medicare reimbursement for RPM shows great promise for improving patient care and outcomes that require continuous monitoring. Since CMS introduced RPM, other payers outside of Medicare and Medicare Advantage plans have begun to reimburse for RPM services. This is why now is an excellent time to register your patients for RPM. As with CCM, there are several billing codes for RPM, but we're only going to focus on 3 during this presentation. You can find a list of all the RPM billing codes with detailed explanations of each code on the CMS website. CPT codes 99453 and 99454 reimburse the expense associated with furnishing RPM services and are based on a 30-day time period. This includes costs associated with monitoring the monitoring device, its placement with the patient, and transmission of data. So let's look at each code and the requirements. Let's start with 99453. It's the initial setup and patient education for the device. This code can only be billed if 16 days of data was collected in the first 30 days after the patient receives the device and is billable one time per patient. So if the patient receives and is educated on the device, but no data or data less than 16 days is transmitted by the device within the first 30 days, then you're not going to be able to bill for this code. So it's vital that we instruct the patients to make sure that they get those vitals taken for 16 days within that 30-day period, so you'll be able to bill for this code. 99454 is data transmission code, remote patient monitoring of physiologic parameters, so blood pressure and pulse oximetry. The patient device must supply 16 days of data transmission each 30 days. This code can only be billed once per 30-day period, even if multiple devices are being utilized. It cannot be reported if a patient doesn't collect 16 days of data in a 30-day period. And vitals must be reported from the device. So if a patient goes out of town and they forget their device, they can't report vitals from a different device or over the phone to the care coordinators. 99457 is the 20 minutes of monitoring and treatment management that includes interactive communication with the patient caregiver during the calendar month. So this code can be reported during the same period as chronic care management, transition of care management, and behavioral health integration services. Time cannot be counted on a day when the physician qualified healthcare professional reports an E&M service. And time cannot be counted when a provider reports an E&M services, including an office visit or other OP services, rest home services, or home services. This code cannot be billed if 20 minutes of phone interaction is not completed in the calendar month. As with CCM, the patients will have a 20% copay if they have Medicare only, but this copay may be covered if the patient has a supplemental coverage. And as we talked about before, some commercial payers are trying to cover this now, and they establish their own copay policies and may not choose to require a copay. RPM billing may seem complex and overwhelming, but DAS is here to assist you to implement our turnkey RPM solution for your practice. Why choose DAS Health as your RPM solution? We want to improve patient care, reduce hospitalizations and in-office visits, and increase revenue as the healthcare system transitions from fee-for-service to pay-for-performance. We help clinicians strengthen their relationships with and improve the experience of their patients by using data sent to them via remote patient monitoring to develop a personalized care plan to engage in joint decision-making to foster better outcomes. RPM can generate an additional source of revenue for your practice. I'm very passionate about both RPM and CCM programs and implementing these into your practice today so that you can have a greater relationship with your patients and add revenue for your practice. When you partner with DAS Health for RPM, you're receiving easy-to-use devices, increased access to care, enrollment assistance through our accelerated enrollment program, efficient device procurement, consistent monthly care, zero upfront cost to your practice, and we offer excellent training and resources and compliance confidence. By choosing our solution, you gain enhanced monitoring and coordination of care between office visits, improved access for patients while eliminating unnecessary in-office visits, enrich patient-practice relationships, superior outcomes through ongoing patient accountability, and proactive identification of health concerns. Patients benefit from our RPM services by increased access to the practice and a dedicated care team, encouragement to follow their healthcare plan, consistent interaction with trained and caring staff, early identification of changes in the patient's health status, and able to use the device in the comfort of their own home, and just to control their overall personal health. How does the process work for RPM? It's very similar to how CCM is implemented in your practice. So we will create and run a report in your EHR to determine which patients are eligible for RPM services. The patient list is then sent for your approval, and once the list is approved, a mailer will be sent out to the patients who are eligible for RPM to soften the ground for our accelerated enrollment calls that are made from your practice's area code. The care team will begin contacting patients via phone and educating each patient on the service being provided and how the devices are shipped and set up. Care coordinators advise the patients of the 20% copay if Medicare only, and the patient has the right to stop services at any time. If the patient does decide to cancel services for RPM, they are not required to return the devices. We just simply turn off the internet from the device. Care coordinators obtain verbal consent for RPM and record it in the patient's health record. Once the patient has accepted the program, we send an order for the device to the provider in the EHR. The order must be approved by the provider before the device will be shipped out to the patient. So after the order is approved, the device is then shipped directly to the patient's home, and the care coordinator tracks that device being shipped so that as soon as it reaches the patient, they contact the patient to assist them with setup of the device and taking their first vital readings on the devices. If for some reason the device is defective when the patient receives it, then we just ship out a new device overnight to the patient. We also can provide brochures for your office that will have a phone number to the care coordinator who can assist in enrolling patients into our RPM program for you. We understand how extremely busy you and your staff are, and we strive to make the enrollment process as efficient as possible for you and your staff. Care coordinators will then call the patients on a monthly basis and maintain a comprehensive care plan. The care coordinators will then download a care plan and a vitals report into the patient's health record monthly. Our goal is to make this program beneficial to you and your patients without adding unnecessary work for your staff. So we utilize the Link Plus device, which is shown here. The device comes with AT&T internet already installed, so the patient doesn't need internet at their home, and they can take the device with them when they travel. I have worked with several devices over the years, and this is by far the easiest to use. Even the most technically challenged patient will be able to utilize this device. It collects readings of vitals by connecting via Bluetooth to the pulse oximetry that we offer and the blood pressure cuff. It delivers an alert if there's an out of range to the care coordinator. It organizes the patient data in an easy-to-read format for the care coordinators and providers, and patients can communicate on the device through to the care coordinators for the iLink device. Patients will receive the Link Plus device as previously shown, the pulse oximeter, and a blood pressure cuff monitor as shown on the slide. Both the pulse oximeter and the blood pressure cuff connect to the Link Plus device via Bluetooth and are extremely easy to use. When the patient receives these devices, they are given detailed instructions on how to use both the pulse oximetry and the blood pressure monitor. If the patient experiences any issues with the device, they will not be reaching out to your staff, but will contact their care coordinator for assistance. This slide shows an example of the vitals report for blood pressure. Readings are sent in real time to the care coordinator's dashboard. And if a reading is out of range, an email will be sent to the practice and the care coordinator. The vitals report will give a 60-day look back and is downloaded along with the comprehensive care plan into the patient's health record in your EHR monthly. Having this report downloaded and easily accessible is a huge benefit. How many times do you ask your patient to track vitals at home and they forget, or they drop the readings off at your front desk and the paper gets lost, or in a scanned document folder on someone's desk to add to that patient's health record? This eliminates all those scenarios where the readings don't reach the provider or the patient's health record. So it's a win-win for everybody. This slide shows additional pages of the vitals report for the patient's blood pressure. And with all the out of range readings in red, as discussed previously, this is a great educational tool to share with your patients and breaks down their blood pressure readings into easy to read graphs. Now that I've convinced you how important CCM and RPM is for your practice, what are the next steps in implementing these programs into your practice? DAS would like to be your partner in virtual care services, not just another vendor you interact with. Helping patients manage and overcome their health obstacles has never been more important. DAS Health provides patient-centered, practice-friendly virtual care services that redefine patient care, deepen patient practice relationships, and increase practice revenue without adding cost to providers. We help healthcare providers deliver high-quality, scalable virtual care services by leveraging the latest technology and qualified, well-trained, expertly managed clinicians. Practices across the country are faced with increased patient volume, staff shortages, physician burnout, and decreased revenue for 2023. Virtual services like chronic care management or remote patient monitoring can assist you to overcome the burdens facing your practice in the coming years. So that wraps up my presentation for CCM and RPM, but I would like to take a few minutes to highlight our cybersecurity division. We have Nick with us to talk about our cybersecurity products and give us an overview. Nick, the floor is yours.
Thank you very much. I appreciate you taking the time to allow me to come in. For those that don't know, here at DAS, we do have a full-blown cybersecurity offering. We have a full team here. I'm currently a cybersecurity analyst, and I am extremely passionate about cybersecurity. I actually teach night classes at a local university. That's how much I love it. So I would just like to take just like 2 minutes and explain a briefly overview of what we do offer to help secure your organization data and also protect your patients. And that's the main goal of cybersecurity. It's not about computers and servers. It's actually just about protecting people. So the next page here, I'll go ahead and go a brief overview. And the strategy we like to address with our clients is identify, protect, detect, respond, and recover. And the best way we found through our experience to identify vulnerabilities or misconfigurations is through what we call an advanced technical security audit. And this is a deep dive into your entire infrastructure on the internal network and also from the external network. And we're looking for vulnerabilities, outdated systems, maybe something wasn't configured right, anything that can elude or expose your organization to any type of risk. And a second way we can accomplish that is through a HIPAA security risk assessment. And these are going to be in the form of a questionnaire, and it'll kind of just help you go through and answer your questions like you do once a year, and it'll help you identify areas that you need to improve on. And moving to the protect, security awareness training, it's a very important thing to have. Making sure your employees are aware and up to date with modern tactics is really one of the best ways you can prevent any type of incident. Things are changing rapidly, and it's not a good idea to constantly rely just on tools, but the employee awareness is what's really going to be something solid and to continue to work on. And our security awareness training platform is very brilliant. It actually includes HIPAA security risk assessment built into it, as well as annual HIPAA trainings, annual cybersecurity trainings. It does dark web scanning and also simulated phishing emails. So it's a very robust, easy to use system that will definitely meet any type of security awareness training needs. Multi-factor authentication, we like to promote any type of remote access into your organization to be protected with multi-factor authentication, just in case that password is compromised or somebody's using a weak password and somebody gets their credentials. At least that second form of authentication will still protect the remote access. We also offer password management. That is probably one of the most stressful things is when you have to create a new account is trying to think of a unique password that's strong, meets the complexity requirements. Having a good password manager will automatically generate very strong passwords and stores it securely. So your staff will only have to remember the password to get into the password manager, and then they'll have access to all of their accounts from there. We do full-blown vulnerability and compliance management. We have a lot of telemetry from the government as well and all of our vendors. Whenever there's a new vulnerability or issue, we jump right on it, and we have the ability to do this remotely. Penetration testing. This is actually included or part of the advanced technical security audit. And this is a very passive way of coming from the outside of how a threat actor would try to gain access into your network. We don't do anything that would cause business disruption or would cause a firewall or a server to go down. We take a lot of finesse in when we do this to not disrupt any workflow. At the same time, we do want to identify any open holes that a threat actor may do using the tools and software that they have access to as well. Protective DNS is extremely important. Everything's today, we're always through the web browser, a lot of cloud applications, using Google or whatnot. Having a protective DNS really just filters the websites and traffic that your employees can access, and it protects them from being directed or redirected to a malicious website that could cause something like credentials or such to be stolen. And I'm going to talk about the next two kind of together. Workforce productivity analytics. Some people may say, why is that in there with security? And really having overall visibility of computer and hardware is extremely important to understand if there's anomalies or something abnormal happening. And having that insight into all the machines and stuff really promotes a strong posture, knowing like being able to detect something small happening and to be able to perceive that, oh, there might be a threat going on. And that moves into the identity management. And this kind of you have all of your data stored somewhere, and it may be securely stored, but you need to think of how you're controlling access to that data and how it's organized and tracked. And really the SAS is software as a service identity management. That's really how the best way to tackle that is really having a nice, clean asset inventory of who has access to what and how that access is being controlled. And next, we're going to move to our respond. So we have a 24/7 security operations center service that we offer. And this has been very efficient in finding a lot of issues with our clients that currently have this. So this is going to monitor your entire IT infrastructure all at once. It's going to ingest all the information from everything into one central database. And then it's going to curate it through machine learning and such, looking for threats, looking for bad activity or threat actors, compromised accounts. And it'll even detect if there's a machine maybe that's reaching out to a malicious IP and creates a connection, our SOC service will actually isolate that machine and give us a call and let us know that that machine's been cut off from the internet. We have found it to be extremely helpful into catching things very early on before any type of damage could be done. And of course, we are all very passionate about cybersecurity. We love it. We love what we do. It's more of a lifestyle. So we're always here for consulting purposes. Anytime you have questions or concerns, feel free to reach out to an account manager or somebody, and we can set up a posture, what we call like a posture review call, and we can just address any concerns that you have or any issues that you're having, and we're always here to help. And all you have to do is just reach out, and we'll make that happen.
Thank you so much, Nick. We appreciate you joining the webinar and giving us that overview.
Absolutely. I appreciate you guys having me. It was very nice of you to send me the invite.
We recommend that you visit us at our website and continue to sign up for our webinars. If you're interested in learning more about the DAS Health, CCM and RPM solutions, please feel free to reach out to your DAS account manager for more information. They will be able to provide you additional details and contact us to provide a more in-depth overview and demonstration. I'm also available to answer any questions. Here's my contact information. Please feel free to reach out to me anytime. I'm always happy to assist or answer any questions that you may have. Lindsay, do we have any questions today?
Yeah, absolutely. So, I mean, wow, Brandy, a ton of great information. Thank you so much for pulling this together. It really sounds like RPM and CCM are awesome opportunities for practices to really better serve patients and of course, increase reimbursement. And of course, happy to hear just how much DAS can do for practices and really alleviate that burden when we partner. So we do have one question in the chat now. I want to remind everyone you can still type a question in the question section of the webinar control panel while we have Brandy here on the line live. So on to our first question. So we had someone ask, do you need to speak to the patient every month on the phone to bill for CCM and RPM?
So let's start with CCM first. So CCM, no. As long as the care coordinator updates the care plan monthly, they do not have to actually speak to the patient on the phone for the 20 minutes. They would spend the 20 minutes updating the care plan and then downloading that care plan into the patient's chart. If we have not made contact with the patient in 90 days, then we unenroll them from the program. For RPM, yes, you have to talk to the patient for the 20 minutes in order to receive, be able to bill for the 99457 code. So you definitely have to visit with the patient for the 20 minutes in order to get billed or reimbursed for RPM.
Awesome. Thank you so much. I believe, yep, they just let us know that answered their question. So thank you so much. I haven't seen any other questions in the chat come through right now. We'll give everyone a minute or so. I know Brandy was extremely thorough, so you know, I get it if you're walking away, if you're feeling a bit overwhelmed with all the information, or as Brandy mentioned, if you have further questions, you see her contact information up on the screen. You know, feel free to reach out. We'll also be sending out a link to the recording and a copy of the slides. You know, feel free to reply back to that email if you do have any questions or if you want to learn more, you know, about our services as well. But Brandy, it doesn't look like we've got anything else coming through right now. So I think we're all set.
Okay, thank you guys so much for joining us for the webinar today. I look forward to working with all of you to implement CCM and RPM into your practice. Everyone have a great day.
Thank you, everyone.